3 of our running course here. I appreciate you participating in this, and I hope this information has been helpful for you. As our goal here at Stretch Physical Therapy is to help you through your running season, prevent any injuries, and perform better. Now in this video 3, I'm going to really talk about gastroc mobility and how you can actually get an improved stretch in that area. But I also am going to give you 2 exercises that you need to start doing to improve strength. And when we're talking about strength in runners, it doesn't matter the age of the runners, but what I typically see is I see that they don't have the toe mobility that they need due to injury, or the neurological aspect of the connection between the brain and the foot has been turned off, so I'm not getting the actual motion on each side due to an injury. So if you can't perform some of those, it's okay. You just want to keep practicing it until it comes back. And if you have a deficit, you can always give us a call at the office. Now today, okay, video 3, we're going to go ahead and go through 3 exercises that you can do. And the first one I'm going to do is start off showing you, I want you to use a lacrosse ball, and this is a tennis ball, but I don't have a lacrosse ball here. I want you to get 2 lacrosse balls and put them together and tape them together so that you have one on each side. And then what we're looking at here is to be able to run, you have to be able to go forward on that ankle, and we call that dorsiflexion of the ankle. And you really need that so that you have the power that you need for your run. Now, normal motion for dorsiflexion is about 10 degrees of dorsiflexion. So when you're coming back, it's neutral is here, and then you should have 10 degrees. Now I'm a little tight here, so we'll demonstrate this. But you're going to need to come back to about 15 degrees to be able to have the proper power and mobility that you need for your run. So before your run, along with your mobility stuff, you can take those 2 lacrosse balls and you actually put them back on the back of the leg here. And you want to find just a tender spot on that gastroc to do this. And what you're going to do is not your typical where you're going to roll it. I want you to just press down into that lacrosse ball. And again, I want you to have 2 of them. And then what I want you to do when you're pressing down on it is go ahead and just pump that ankle without letting the knee come up. And you're going to feel a deep tissue release in there when you're doing that. So I want you to do that for about 30 seconds. And then you're going to move down to another trigger point and do the same thing from there. Again, not letting the knee bend. You're just going to take that ankle and pump it. And then down another one. And you want to do that 2 or 3 times. And once you've done that completely, you should have had enough of a soft tissue release in there. See, I have a little bit more motion in there. Now you can go and do that common stretch that you do off the back of a stair or here. And you want to make sure that your toe is not pointing out when you do this. You want it to be straight forward, and you want to lean into that with the leg straight, and then after that, lean with the knee bent so that you can get that soleus. And that'll give you that gastroc length that you will need before you run. So you do this sort of trigger point release before you run, and then you can foam roll and do your static stretching after your run is complete, because the blood flow is there for your muscles to be able to lengthen those muscles. Now the 2 other exercises that I want you to do in this program, because you need core strength and you need glute strength for running. And you've probably done these before, I want you to get in a position to where your knees are stacked on top of each other, and then I want you just to be able to take your hip up to here, hold it for 5, back down, and I want you to bring your ankle up. So you're going to go here, open up, and then ankle up. So I want you to do 10 of those, and if this is easy to do, then I want you to make sure you start with a band, and when you're doing these exercises, if you can get to 20 without fatigue, then you need to increase the resistance of your band. And you need to do that on both sides. The last exercise that I want you to do for strength for core is what we call a dying bug. And you're actually going to take and press your pelvis so that it is flattened to the bed. And then you want to release it just a little bit, not an arch, but just a little bit. And when you do that, hands are up here and you're literally going back and forth. And I want you to do this for 30 seconds and do 10 of these. And I want you to do this daily. So those are the top 3 strengthening exercises that you can start doing right now and implementing into a daily routine. Combine those with your mobility exercises that I taught you in video 2. And then performing your dynamic warm-up before you run will help keep you and prevent injury with your running season and help you with some performance as well. Now, if you have any questions or concerns, or you have this nagging injury that you're concerned is going to sideline you before the big running event that you've got scheduled, then please feel free to give us a call at Stretch Physical Therapy at 513-874-8800, and we are so happy to be able to help you. Our big goal here is to help you get to the running event and then run the best that you've ever run. Have a great day. I hope this helps.